All right, this is going to be Chapter 14, the Lymphatic System and Immunity, Part 1. And the first introduction we're going to talk about is pathogens. And pathogens pretty much are the development or disease genesis. Pathogens are responsible for disease. There are examples of pathogens are going to be things like viruses, bacteria, fungi, parasites, and they'll pretty much thrive in our bodies and use our bodies as an environment until they're acted upon by some other source, whether it be our immune system or, say, an antibiotic or some kind of product that would kill them. Lymphatic systems pretty much interact with the cells and other organ systems to defend the body. These are pretty much the trash cans of the body. They are also very important in the ability of the body to initiate the immune system. Organizations of the lymphatics. So we're going to talk about components, functions of the lymphatic system, lymphatic vessels, lymphocytes, lymphoid organs, roles of the lymphatic system in the body's defenses. And the first thing we're going to talk about is components here. And these things are going to run throughout the body just pretty much like the veins and the arteries did. Vessels, lymphatic system or lymphatic vessels begin with the peripheral tissues and end at the connections of the veins. Fluid, and the fluid that's in them is called lymph, flows through the lymphatic vessels, resembles plasma, contains a much lower amount of suspended proteins though than the plasma does. Lymphocytes, another term, which are special cells that perform an array of functions in defending the body. Lymphoid tissues and organs, tissues collection of loose connective tissues and lymphocytes, and the structures called lymphoid nodules, and the examples of these are going to be tonsils, lymph nodes throughout the body. Complex structures contain large number of lymphocytes. These are connected to the lymphatic vessels through the lymph nodes. Spleen and thymus are examples of these complex organs. And these are pretty much the lymphatics throughout the body. They're pretty much like trash cans. They allow drainage. They get our immune system on the spot very quickly. Large amounts of them drain this area into lymph nodes that are in the chest. The spleen has a large number of lymphocytes in it. Lymphoid nodules of the intestine. I mean, do you think that there's anything as far as bacteria and stuff that goes through your intestine? We'll mostly see lymphoid nodules in areas where there's openings. So mouth and nose, there's a lot of lymphoid nodules. These have the ability to protect the body against disease in these areas. Functions of the lymphatics. They produce and maintain and distribute lymphocytes. The return of fluid and solutes from the peripheral tissues and the blood. The distribution of hormones, nutrients, and waste products from their tissues of origin to a general circulation. So if they have waste products and they're trying to get it out of the body, easiest way to do that is to put it into the lymphoid structures or the return circulation and get it to wherever it needs to go to. Most commonly, we'll eliminate it in the intestine. Functions of the lymphatic system: the production, maintenance, and distribution of lymphocytes. Lymphocytes respond to invading pathogens. Examples of these are going to be bacterial or viruses, and abnormal cell bodies. Virus infections that changes the DNA of the actual cell as it's replicating. Foreign proteins, toxins produced by bacteria, and these are going to be endotoxins and exotoxins as the bacteria actually dies. They release poisons in the surrounding tissue. It's kind of like saying, yeah, I'll go, but I'm taking someone with me. Functions of the lymphatic system continue here. The return of fluids and solutes from the peripheral tissues to the blood. Return of tissue fluids through the lymphatic system maintains normal blood volume and eliminates variation in interstitial fluid. So any extracellular fluid that you would have or any fluid sitting around in the tissues, what the lymphatics do is they help adjust that and allow that fluid back in if it's needed. It depends on the osmotic pressure in the system. If the fluid is thicker and needs diluted out, there will probably be more fluid added to it, and so on. Distribution of hormones and nutrients and waste products from their tissues of origin to the general circulation. Substances unable to enter the bloodstream directly may do so way of the lymphatic vessels. Lymphatic vessels continue to carry lymph from the peripheral tissues to the venous system. Blockage of a lymphatic vessel from a limb may cause the limb to swell due to an accumulation of interstitial fluid, and this would be extracellular fluid, that is out in a spot and the lymphatics get blocked from whatever reason, a bunch of exudate building up or whatever, this will cause swelling to occur in that area. And these are lymphatics kind of here, this green area that I'm kind of marking. This would be the arterial, precapillary sphincter, capillaries, venous return. All of this extracellular fluid that's outside of the vessels pretty much can flow into the lymphatics. Figure 14.3 in your book, this is kind of given distribution. There is a large amount of drainage structures in your chest, and that's because we bring air into here continuously. So again, there's going to have to be the ability to incite the immune system very quickly. The green here is the drainage of the thoracic duct, which is a lot of drainage, and this right here, this light, is the drainage of the right lymphatic duct. They kind of overlap in areas, left and so on. You'll have lymph nodes in this area as well. Lymphocytes. Now this is what the lymph nodes kind of carry around with them and give the ability to bring them out in a very quick response. The types of circulating lymphocytes, which are in the lymphatics, there's going to be T cells, there's going to be B cells, and there's going to be NK cells. T cells are cytotoxic T cells, thymus dependent, which means that these things are going to be under the effects of thymosins. Directly attack foreign cells or bodily cells infected by viruses. And these T cells, or cytotoxic cells, pretty much spit out like a chemical warfare, if you will. It's called perforin, which we'll talk about here in a minute, but it gives them the ability to perforate the cellular walls and essentially eat them or become macrophagic. The B cells, or bone cells, can differentiate into plasma cells, and plasma cells, the important thing on this is, produce and secrete antibodies. So this is what's going to give us our long-term immunity. Antibodies bind to a specific antigen, and that's what kind of throws our immune system, throws the flag up. But there's a war over here, please come help. And then we have NK cells, or natural killer cells. Lymphocytes attack foreign cells, normal cells infected by viruses, and cancer cells that appear in normal tissues. So any of these normal cells affected by viruses, foreign cells, or cancer cells that the natural killer cell sees, is just like somehow their all excess pass has got messed up. The body presents proteins called, they'll have antigens and antibodies on the surface of these cells, and essentially these cells will present with a protein, and this protein essentially allows the cell free access as it would like wherever it wants to go, because that's the all access pass. That's the pass, the histocompatibility pass, that says I am me, or I am insert name here. If it says something other than what it should, I am a panda bear when I should be a human being, then that's going to be problematic. The immune system is going to attack it at that point. These NK cells would attack it directly and try to devour it or perform a macrophagic action. The origin of circulating lymphocytes. Lymphocytes in the blood, the bone marrow, and spleen and thymus and peripheral lymphoid tissues are visitors and pretty much not residents. Lymphocytes move throughout the body. They enter a tissue, then wander to a blood vessel or lymphatic vessel for transport to another site. So these things go in and out, and they're kind of all around, and they're mostly circulating. Lymphopoiesis, production and the development of lymphocytes, starts in the bone marrow T cells, are matured by the thymus and thymosins. B cells and NK cells are developed from the lymphoid stem cells. And this should be a review from the blood section. Hemocytoblast, lymphoid stem cell. Now, if we're under the effect of thymosins or thymus hormones, thymic hormones, the lymphoid stem cells will produce a T cell and then mature it very rapidly, much like the red blood cell did. This gives us a mature T cell that gives us a cellular mediated immunity. Now what this means is this is dumb immunity, and what I mean that is it is an all alarm, and the all alarm would come rushing. So all of these cells are going to come rushing, and they're going to come with an appetite. This over here, under the effects of thymosins as well, makes something called a B cell and natural killers. These are kind of the police or security, internal security, if you will. If they see something that doesn't belong or doesn't have that all excess pass, they're going to attack it. The B cells pretty much have our long-term antibody, and this goes back to a theory whenever I was in the military. B cells and antibodies are kind of like hot sauce. Now I'm going to tell you why. Hot sauce is said, this is said about hot sauce, that you can eat anything if you get enough hot sauce on it. This is the same way with those antibodies. When those antibodies are made and they have an antigen-antibody reaction, they make it to where the macrophagic cells of the body can essentially eat it without any problem whatsoever. So antibodies are very important, especially if we've come into contact with this in the past, that we can create cells that are specifically attuned to devour or eat the substance. Lymphoid nodules. Lymphoid tissues are composed of loose connective tissue and lymphocytes. The reason they're loose connective tissue, so they can expand. Lymphoid nodules, masses of lymphoid tissue, are not surrounded by a fibrous capsule. They can increase or decrease in size. An example of this is going to be the tonsils. Large lymphoid nodules in the wall of the pharynx. Lymphoid organs. Lymph nodes. Small oval lymphoid organs covered by a fibrous capsule. We have afferent lymphatics and efferent lymphatics. Afferent lymphatics, lymph, and this would be the lymph system to the node. So if you had a lymph node here, the afferent version would be bringing lymph back to it. The efferent version onward to the venous system. So instead of hanging out in the node, this is going to go out and get in a vein. The thymus, pink gland that lies in the mediastinum posterior to the sternum. It is a site of T cell production and maturation. The spleen contains the largest collection of lymphoid tissues in the body. And this is a child, figure 14.5, and these are all the lymph nodes or pharyngeal tonsils. These are lymphoid tissues. These are designed to immediately have a reaction if we have an antigen-antibody reaction. This is a lymphoid tissue cross-section, afferent towards the lymph, efferent away from the lymph, and this is going to be blood supply to the lymph node. Essentially has a cortex, medulla, thymus is here, and this is in the mediastinum. This is just below the thyroid gland. Parathyroid is the posterior area of this right here, as on the back side. The thymus is what allows for T cells to mature and do what they're supposed to do, initiate the cellular mediated response. The spleen is over here, and everyone take a good look now. This is nice and tight and has well-defined margins. All right, this is a cross section of this person. The spleen houses an extra supply of blood. In addition to that, it also is very important that we get off a very bulky and very aggressive cellular mediated response, and it assists with that. Clinical note here, injuries to the spleen, and it's very simple how they treat it. Pretty much contact sports is what causes this. Examples, football, hockey, and so on. Conservative approach, and this is on treatment, and they pretty much watch their hemoglobin level. Now, hemoglobin level is the oxygen carrying capacity, so at the point that they continue to bleed and their hemoglobin level is decreasing, they may elect to go in and surgically remove the spleen or perform a splenectomy. Now, this kind of is problematic for the person because it makes them have a greater chance of infection. And if we'll take a look over here, do we see well-defined margins? And this is kind of blowed out here. We got blood. And the answer is no, we do not see well-defined margins. The reason that we don't is because the spleen is ruptured. Role of the lymphatic system in the body's defenses. It has two roles, nonspecific and specific defenses. So in the nonspecific defenses, which means that it's not really specific for anything, they deny entry or limit the spread within the body of microorganisms or other environmental agents. And specific defenses is provided by the coordinated activity of the T cells and B cells, which respond to the presence of a specific antigen. Now, this thing is going to have to present with an antibody. That means that we're going to have contact with it before. Non-specific defenses, physical barriers, phagocytes, immunological surveillance, interferons, complement, inflammation, fever, and then a clinical note on fever is what we're going to talk about here. In the non-specific defenses, just very simply, they deny entry. These are going to be things like the skin and barriers that are set up throughout the body. Physical barriers, sweat glands, hair, secretions, the actual epithelium. We have cellular mediated. These are non-specific defenses here, which are white blood cells. Immunological surveillance, they destroy abnormal cells. You have not got an all-access pass, so it targets them and marks them for destruction. Interferons increase resistance to cells to viral infections, slow the spread of the disease. Interferons released by activated lymphocytes, macrophages, or virus-infected cells. What this does is this kind of helps decrease the ability of this thing to proliferate, because this is going to excite the immune system and have us attacking it at any given point. Complement system. The complement system attacks and breaks down the cell walls. It is like a big gigantic dinner bell. So think of it as an axe that rings a dinner bell. So the axe comes along and it chops up, it sticks to the actual substance and blows it up from the inside. Causes it to actually perforate and release cellular material, and then it essentially and chemically rings a dinner bell. Inflammatory response. A mast cell is a cell that is chock full of all these little granules, and all of these little granules have histamine in them. Histamine is a massive vasodilator. It's specifically designed to keep the infection or the bacteria in the location that it's currently in, so that it cannot perform diabetes or move back into the circulation and get everywhere in the body. It will keep it isolated to this one location. And then fever. Fever is kind of a good thing, only to a certain point. Mobilizes defenses, accelerates repairs, and inhibits pathogens. Most pathogens of bacteria live at a specific temperature. So as the fever rises, it makes it unfavorable for them to proliferate or reproduce. Physical barriers, epithelium, keratin coating, sebaceous glands, digestive and respiratory urinary tract. Mucus has a special enzyme in it, and antibodies, and very acidic pH. So as soon as the bacteria hit there, it starts dissolving or breaking them down. Phagocytes, which is the cellular mediated process. First line of cellular defense. Often remove microorganisms before lymphocytes become aware of foreign presence. Macrophages, neutrophils, and eosinophils. These cells leave the blood and interperipheral tissues that are injured or infected. Macrophages, large active phagocytic cells derived from circulating monocytes. All can move through capillary walls by squeezing between adjacent endothelial cells. This is known as diabetes. And they repel or attract, they're attracted by chemicals and surrounding fluids. This is known as chemostaxis. All right, so quick breakdown of what we just read. 1, they eat. They're like Pac-Man. They can go in and out of the cellular environment through something called diapetes. So they can move in and out of the vessels and the capillary walls very easy. And the chemostaxis, they can either repel or attract surrounding they essentially throw up the flag for I need assistance here. So as they're releasing these chemical signals, other white blood cells are seeing that and headed that direction. Immunological surveillance. Abnormal cells are attacked or destroyed, and NK cells recognize abnormal cells and secrete a substance called perforin. Perforin is kind of like a tank round. And what I mean by that is that we have a cell here that pretty much our macrophages can't eat. So here comes perforin. And what I mean by a tank round is, boom, that this perforates so that the cytoplasm starts to leak in the surrounding area. This allows the macrophages a better chance of breaking them down. The macrophages are like sharks in the water. They're like a great white shark. They smell blood in the water and they're going to come find out what's going on. Interferons, small proteins released by activated lymphocytes, macrophages, and tissue cells infected with viruses. Normal cells exposed to interferons will produce antiviral proteins. An example of an interferon is a cytokine. Complement, 11 plasma proteins, complements the actions of antibodies, attracts phagocytes, dinner bell, stimulates phagocytosis, stimulates eating, destroys cell membranes, makes the meal even more palatable, and promotes inflammation. So it promotes big dinners. That's what complement does. Complement essentially is a gigantic dinner bell when released. Inflammation, localized tissue response to injury, swelling, redness, and heat and pain. Everyone probably has all had inflammation or swelling to an area. Stimulated by dying cells or damage to the loose connective tissue. Mast cells release two things whenever they get degranulated or inflammation triggers. They release something called histamine, which causes vasodilation. In an area, we can see this as swelling, and heparin into the interstitial fluid. And the reason that we fire off heparin in there is we do not want the common pathway formed on hemostasis or clotting. We actually want it to be pretty thin so that the diapetes can work and we can get the white blood cell to the right spot. All right, so figure 1411, tissue damage occurs. Area becomes red, swollen, and painful. Dilation of the vessels, increase blood flow, increase permeability. This was brought about by a degranulation of a mast cell because it released histamine and heparin. Attracts also in this release phagocytosis, especially neutrophils. What these things are going to do is it rung the first dinner bell. So this degranulation is come and get it. Off of the dilation of the vessels, we get hemostasis occurring. The dinner bell itself attracted more phagocytes, especially neutrophils, released cytokines, removal of debris, and by neutrophils and macrophages as a stimulation of fibroblasts. And what we're trying to do here is form a fibrin polymer or scar in the area to where healing can occur. Fever, greater than 99 degrees. Hypothalamus regulates body temperature. We learned this from the endocrine chapter, and we have something called pyrogens, and they are circulating proteins that can reset the thermostat in the hypothalamus, and this can cause a rise in the temperature. But the temperature itself, or the fever, mobilizes defenses, it accelerates repairs, and it inhibits pathogen development. Because, like I said, they only want to live at a certain temperature. If we got pathogens setting up shop in our body, and we have pyrogens that are released, what that essentially does is that temperature spike may create an environment where they cannot reproduce or replicate. Clinical notes is on fever. Fever is kind of a good thing. Anything over 103 degrees core isn't a good thing. At 106 degrees, your brain is done. It is cooked. Febrile seizures, whenever they develop, are not from the spike as they are the speed that the spike occurred. So whenever someone has a febrile seizure, the febrile seizure won't make them 104 or 105. Their temperature may only get to 99 or 100. It's not from how high it went. It's from how fast it rose. Cooling these patients are going to be controversial, and we should never allow the patient to shiver. Shivering incites heat and will make them warmer and hotter. This ends part 1. If you have any questions, feel free to contact me. My name is Roy Smith, 405-219-7613, or you can email me at smithr@msa.net. Thank you.